Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
Thank you for watching Conversations with Jennylyn. Today, my guest is Félix Amiot, and he is the co-founder and president, CEO of EchoFirst French Emergency Medicine. Welcome to Conversations with Jennylyn, and thank you so much for taking the time, Félix.
Thank you for your invitation.
I am very excited to do this segment with you because we know that the world is being plagued by COVID-19, and I'm curious about different countries and what the experience is like for the people living there and the people helping people who are affected there. And you are one of the people helping affected people.
I try. Yeah. yeah. That's my job.
Okay, so you are an emergency room physician in Paris.
No, I'm an emergency resident, and I'm based in Normandy, at north of France.
Okay.
Around Caen, is the city of Caen.
Okay, so what has this experience been like for you?
We were well prepared because we got the experience from Italy,
Yes.
and then the first cases went from the east, from France, and all the doctors from east emergency wards and hospital warned us about all the case who potentially will be coming. So we were well prepared. We took a hit, but that went pretty good. We are now stabilized, and I think that was a great preparation from our region. Yeah.
So how many cases have you seen to date, and how many deaths have you had that you know of?
No, personally, I don't know. I don't count the death and the people I have seen, because I think there is a large number now, because I'm in first line in emergency settings, and we don't count, and we do not do that. But we saw a lot of cases, and there were a lot of death.
I was just asking, based on what your news has reported, if you had heard the news reports.
Oh no, I don't. We actually, in emergency ward, we don't look at newspaper news, or if we just know if the cases are stabilized, upping or downing, but we don't count anything because it's too hard for us. We just need to be focused on what we are doing, and don't be like, we don't count.
Okay. Have you had a lot of deaths on account of the COVID-19?
A lot of what?
Deaths. Have a lot of people died who've come in with the disease?
Yeah. A lot. It was a very strange disease, because the people were coming good, or seems like they were good, and like 2 hours or 3 hours later they went very bad. So this is a very strange disease, because you can pass to good to very, very bad in a few hours, and this is not normal for us. And yes, we lost patients.
Other physicians and people working in medicine that I've spoken with over the last month have indicated that most of the people that they've lost are older people or people with some sort of a disease. Is that true of the people that are dying in your hospital where you are a resident?
Yeah, they are people who are older and who have like a heart disease or heart condition, or they died a lot more. But this is not an elder disease. We lost some young patients, and yes, you die more if you have hypertension, or if you are older. But you can be affected when you are young, and you can die potentially when you are younger. Yeah.
Okay, well, I'm sorry to hear that, because a lot of the reports that we were getting, they were claiming that most of the people that were dying were older who had illnesses, and they
Yeah.
weren't losing a lot of young people to the disease. But lately, it seems like it's not discriminating. No,
It's
different
it's
age groups
yeah,
are dying.
it's discriminating because it's now known that you die. You are you If you are older, you are more chances to potentially have a very bad condition. But if you are younger, you are less chances, but you can have a bad condition when you are young with the disease. Yeah.
The hospital where you work, is it a big hospital?
Yeah, it's a big hospital. Yeah.
Okay, so how many beds do you guys have for COVID-19 patients?
Beds, I think in all the Normandy region, we have 213 ICU beds. So this is for very bad condition and ICU beds, yeah. And in the hospital, I think we got about 100 beds for just hospital beds, not ICU beds for
Are you
coronavirus.
using them all?
Yeah, we fill them. Yeah, in
Oh, wow.
at the top we fill all the beds. Yeah, we filled all the
And
beds.
is your hospital a socialized medicine hospital, or is it a private hospital?
Socialized. Yeah, well,
Socialized.
I work on a public hospital. Yeah.
Okay. Wow. So you guys have been busy. How is that? Is that very challenging for you? Have you been working long hours? We've seen pictures of different hospitals where the staff is sleeping in the hallway because they're so tired. Is that true where you are working now?
We actually we do 24-hour shift, so we are used to that. We are used to our 24 hours shifts. So yeah, no, there were no sleeping in the wards. But yeah, we are tired because there were a lot of pressure. We cancel our holidays. We cancel all. Yeah, there was a lot of pressure and a lot of yeah. We are tired. Yeah, for sure.
Do you anticipate this plateauing anytime soon?
What, listen?
Do you anticipate the cases plateauing, contaminated cases?
Yeah,
You
this world where the because of the east of the Francis, the France took a big hit. So they warned us that we would take this hit maybe later, and we got like 1 or 2 weeks to be prepared, and yeah, that went pretty good.
Well, I'm glad you had some time to prepare for it, because so many
Yeah.
countries weren't prepared and they didn't have the necessary equipment. The ventilators, I hear, has been a shortage in most countries, but it doesn't sound like a problem for you at your
Uh,
hospital.
um, it's because in France we have a difference in organization, because like in the United States, when you have needed ventilator, mechanical ventilation needed, you got the ventilator in one hospital and you cannot move the patient because you have only paramedics to drag and drop. In France, we have different organization because we have doctors who can take a patient and take him to another hospital. So we just managed to put where there were a lot of patients in the east. We took a bit of patient from east, a bit of patient from Paris, and we just yeah, drag all the patients and organize a bit more. And yeah, we didn't need it more ventilator, but we used all we got.
Well, as a resident, this is probably going to be the most challenging time that you are going to experience in your career in medicine.
I
What
think,
do you think?
yeah, I think that's actually that we never saw. That this was never seen in other career or in the like 100 years. So yeah, this actually is the most challenging I've got. But yeah,
Did you
that's
did you
my job.
anticipate anything like this when you chose this field?
No, no, but we choose emergency settings and we choose to manage catastrophic events. Um, Catastrophic events can be from one patient or many patients, but we choose medical specialty who can organize. And yeah, that was very intellectually speaking, that was very nice, because we could think about all the organization and how to manage the patients.
Yeah.
And there were a real all the doctors were together, and that was very fine.
Were you born and raised in Normandy, where you live?
Yeah, born and raised.
Okay. And do you feel that you made the best choice for a career looking back? I know you seem like you're still very young.
Yeah, I'm 25.
You're 25.
Yeah.
So many times I've spoken to people during their lives and they go, I think I should have chosen this career instead of this one. You're still very happy that you chose to become a
Yeah.
doctor.
Initially, I chose general practice,
Uh-huh.
but I revetted my choice for emergency medicine, and I will never regret that, I think.
So you're enjoying it.
Yeah, I'm enjoying it. It's very, yeah, I'm tired. We have a lot of work. I work on you said, on my company with ultrasonography. I work on the hospital. I work on live with the webinars. I work a lot, but that's very nice. Yeah.
So tell us a little bit about EchoFirst.
Um, EchoFirst is an ultrasonography training organization for medicals and medical staff, because as you might know, ultrasonography is modernizing, and we see now a lot in medical practice. We see movement from ultrasonography, and we choose to create an organization for trained resident, for trained doctors, for every specialty, to let yeah to become a big organization uh, for everyone in France and in all Europe.
Wow, congratulations. Where did the
Thank you.
idea to do that come from?
The idea, we already organized some trainings for attendees or residents, and this was very good. We have good reports. So one day we decided that we will create this EchoFirst organization, and we want to be modern. We want to be in our year. We have tickets. We have plenty of things online, and we want to modernize all the training organization and ultrasonography organization.
That's great. And you are the CEO.
Yeah, I'm the CEO and the co-founder. The other co-founder is my fellow mate, who is the chief of the emergency settings in one of the hospital in Normandy.
You are a busy guy because you're a resident as well as you're spearheading this organization, and now you're treating corona patients. And you look nice and fresh now. How are you managing all of this?
I manage this with some coffee, a lot of water, some sport, but yeah, I sleep well. I just organize all my day to be more productive. I don't watch TV, or I don't watch series. Yeah, I just try to be as much as productive as I can all day long. And yeah, I'm passionate about my job, so this is not this is fine for me. I love that.
Well, congratulations. I like the
Thank you.
passion. I too love what I love, so I can I can relate to enjoying what you do. There's so many people in the world who have to do things they're not enjoying. So
Yeah,
congratulations and continue the good work. Now, you just
thank you.
told me earlier that you work a 24-hour shift.
Yeah.
So is that every other day? I mean, how does your work schedule? What is it like?
Yeah, generally, we need in the law, if you work in emergency settings, you need to do 39 hours by week. So we have a 24-hour shift. Sometimes we do days, and generally we do two 24 hours by week. We like if Monday if on Monday we do 20 hours shift, and like we can do it on Wednesday or on Friday or Saturday. It depends. But yeah, general schedules is two 24-hour shift by week, and the other day we rest or just other things. But our we have a comfortable life because we work 24 hours and then we have free time, but we work on weekends a lot.
Okay. Are you hopeful that we're going to have a vaccine in 18 months like they are predicting?
I'm not an expert about vaccine and stuff, but we do know that coronavirus may not be as immune, an immune disease as we thought. So I really don't know. I'm not an expert, so I won't pronounce on that.
Okay, I was just trying to get your opinion.
My opinion, personally, when I'm not sure about what I'm saying, I rather take it back. But yeah, I think they will succeed because we have many resources, and but really, I don't know. I'm not a bacteriologist, and I'm
Okay,
not a vaccine specialist.
okay. And what do you find most challenging right now dealing with the virus?
The most challenging right
Yeah.
now, the most challenging. Uh, yeah, I think the most challenging right now is that the clinical aspect from this disease are not usual. We are not used to that. We are not used to this clinical aspect, and we have to work and to refresh our knowledge. And every day, knowledge are changing. So this is very challenging because you need to be on point. Every day there are many changes about clinical condition, about biological condition, about treatment, and you need to be on point. And this is what I love, but this is the most challenging things because you need to be on point. Yeah.
And do you feel like as a practitioner, you and your fellow practitioners are being protected adequately? Are you concerned for your safety and theirs in terms of getting this disease while treating someone?
Yeah, we are scared about having the disease. I didn't see my parents or friends or anything because when I work at the ward, I may I may caught the virus, but this is the part of the job. We accept the risk, but we are actually I think we are well protected because there are some conditions where there are some things where we are not fully protected, but in global the organization, we have one sector from coronavirus, we have one free sector. So I think the organization may have protected us a lot, but yeah, we are all scared about taking we are all scared for the disease. Yeah.
So to date, you or no one you know that you work with or that you're close to has contracted the disease?
Oh yeah, many doctors I know.
Oh,
My neighbor got the virus and
oh
just
no.
knock at my door and tell me I don't feel great. Can I can you examine me? Yeah, and he got the coronavirus. And yeah, no, I live with one fellow mate and he didn't got the virus. He's a radiologist, but there are a lot of residents, a lot of practitioners I know that have caught the virus, like 5 or 10, I think, and my neighbor, it was the close, I think.
But they've all recovered, right?
What?
they all recovered?
Yeah, they all recovered.
Okay,
They all
that's
recovered.
great. That's really.
I have no fellow mate or friend he's right now very serious.
You know, I heard something very sad from another physician that I interviewed, and he's a doctor in Mexico, and he told me there's a stigma attached now to you healthcare providers, where when people see them coming, they're running from them. I think that's so sad. They should be bowing. We should be bowing down to you guys.
Not bowing, I think, but no, yeah, I heard that some friends are being warned by their neighbor to go in other apartment. I have one friend on that case, but no, I personally, I didn't experience that. All the people are nice. Yeah, no, I think, yeah, I heard that friends are experiencing that. I have one friend who is uh, wanted by his neighbor to go away, but me personally, no.
Well, I'm happy to hear that, because I would not run from anyone that's taking care of people with corona. I think it's sad to do that, because it takes a lot of courage every day to go out there and do that. The little I know of it, it sounds like these patients need continuous undivided care and attention.
Yeah, they need continuous attention because they can go worse in about hours or minutes. So this is very challenging for us because we don't actually, this is a disease we don't really know what we are talking about. We don't know any treatment because it's a viral disease. Normally when you got viral disease you don't need any treatment. uh, it go away alone, but there are some clinical signs we really don't know, and we at the beginning we didn't know why they were worsening like that in about minutes.
There are a lot of people who buy into conspiracies, and I have had some very heated discussions with a few of them, where their argument is someone is trying to mess with the economy, and this disease is not as bad as the media is telling us. You are someone working on the forefront, dealing with this disease face to face very often. What would you like to say to those people that are claiming this is just another virus? Because there's still people claiming this, believe it or
Yeah,
not.
yeah, I would say that come with me on one shift. You will see. Please come,
I
please.
will make sure I send this interview to them.
Yeah, please, please come with no. I don't believe in this conspiracy. I believe in. I'm a scientist and I'm a doctor. I believe in science, and science tell me that this disease is serious, and I saw very serious patients. I saw a lot of cases in ICU. I saw ICU filled from patients, and I never see that before. So I just yeah, this is a very serious disease. I don't believe in conspiracy. I believe in science.
Well, thank you very much, because I can't imagine how anyone can argue about this
I,
when
I,
there's so
I
many.
don't want to discuss with these people.
I've had to shut down a few conversations because it was the right thing to do at the time. What would you like to say to people who are still in doubt about if they need to be quarantined? What is your feeling? What is your message for them?
I think we worked hard and we worked as doctors, but the people and the population worked hard to be like alone and to not socialize with people. This is very hard for them and us because we are people too. We are doctors, but we are also people. In my free time, I'm in my home and I cannot go outside. I pay attention for what I touch or things, and we worked hard. So this would be a shame if we mess this work in about week a week because we didn't yeah we the deadline is fixed, so we need to go to this deadline. It would be a mess if we just break this work and go outside before this deadline. Yeah, so please stay inside.
And your city is still on quarantine. How long
Yeah,
have you guys been on quarantine? Do you
all
know?
France is on quarantine. Yeah.
And they're not talking about lifting that anytime soon, are they?
Yes, yeah, they are talking about lifting it in 11th of May.
Mhm.
But in condition, not all the city, not all the region, and if this go, we could go outside if every condition would be ruined, and this is actually not the case right now.
As a doctor and a scientist, what will you do different after this has passed and life is returned to what's going to be known as normal? Because I suspect it will be different. What will you
Yeah,
do differently?
I think personally, I will not do things differently in my personal life because I didn't change anything in my personal life. Yeah, I just protected myself. So this would be like every day. But in our wards, in our shift now, I think we will be more prepared about what can come and what can we expect from massive disease, and I think we will protect us a bit more because in France we are like when we intubate a patient, sometimes we don't have any mask before the disease, and we play a bit with a game, a very dangerous game, and I think we won't play that game anymore.
So you're always going to wear your mask and prepare and protect yourself.
I think in the ICU, I think I will wear a mask more often that I used to wear. Yeah.
Yeah. You can't go wrong with that, and why not? Because you never know what's going to come
Yeah.
next.
Yeah.
I have a gut feeling this virus will change its characteristics and attack us in a different way. So we have to be on guard at all times and always practice perfect and the best hygiene, those of us who weren't. Do you agree with me?
I don't know if this virus will take us in another side. I think there is serious attention about second wave because there are many people who go outside right now, and there are a really big risk. And because in France we are stabilized, but in the United States you are not very stabilized right now. There are a big risk for a second wave, and we are all tired. The second wave is very risky because we are all tired. We didn't take any holidays since like uh, months, so I think it will be dangerous if there is a second wave right now. um, yeah, this is what I think.
Well, I agree with you, and thank you for sharing that with us. What has Felix learned about Felix since
What
the
is um
virus?
what's Felix? That's a good question. um Felix learned to be more proactive in his days because as I told you, I have a lot of work right now, uh, and there were days or I just hang out or be a bit yeah. I didn't focus on some things, and now I learned more to focus on things what I need to do and do not procrastinate. Yeah, I have to do things in my day. I need to do it, and I start early. I finish early if I can, but I do it, and I don't procrastinate anymore.
Anymore.
Anymore. Or some days I try.
I know that you're having a very different experience from many other people that I've been speaking with because you are a practicing, well, you're a physician, even though you're just an intern at the moment, you are working as a
Yeah,
physician. So
yeah,
every day you have to go out and you have to face this. For a lot of us, it's a complete opposite. We have to stay at home and we have to work from home. And
yeah,
so a lot of us are learning that we can accomplish so much from just staying at home with the computer.
yeah.
And we don't need to travel as much as we used to travel and such. When you go to work, do you drive yourself to work?
No, because um, my home is like 5 minutes by foot to the hospital. So I go skating to the hospital, and this is my workout from morning workout. I go skating to the hospital, and this is got me a fresh air, a bit of sun, and yeah, I go to skate.
Well, are you happy with the compliance of the residents in your city? Have people been compliant? Have they been following the rules? And
Yeah. Oh, I've been following those. Yeah, I'm very proud of our teams, or all our doctors or residents or anything, because we cancel everything. We cancel our wards, and we just yeah, there were a night shift, had a night shift for everyone, plans, and yeah, they they were compliant. They were great. There were no like, yeah, this was great. This was very great.
and when you're out in the street, have you noticed that people are keeping their social distancing and
Yeah.
they're okay? That's great.
Yeah, because I think in my city, I live in a student city. 1/3 of this city population is a student. So there were many students who go to her or his parents, and the other side of the students, young people tend to be more compliant about that, I think. Yeah, in my city, I'm very proud of my city, because in the early stage there were no people in the city, nobody. Yeah, I'm very proud.
Well, I am very proud of you. I'm very proud of your attitude. Thank you for all that you're doing for the people in the hospital where you work. Thank you for this message you're leaving with me for people watching this segment. And we're almost out of time. Can you believe 30 minutes is already gone?
Oh.
What do you want to leave with anybody watching this segment, that's related to Corona or not? Any message you want to leave with the viewers, please go ahead.
The message, I think, is what I just said, is be proud, because we faced a big disease, and there are many medias who think we are not as good as we thought, but we were good, and we are actually fine. Keep on that. Read some scientist article and be critical about everything. Don't believe in conspiracy theory, and yeah, just think, and that would be great.
Yeah, because this disease is real. You fight it
Yeah,
every day.
this is real. This is real. This is not conspiracy. This is very real. Yeah.
Well, Felix, thank you so much. I know that you're very busy and you've been working very hard, and I don't know what you're doing because you look great. So
thank you very much.
So keep up the fight, keep up the good work. I'm very proud of all that every single treating physician, every service provider in the world, especially at this time, those of you who are having to go out and face this virus every day, we thank you so much. There are not enough words to express the gratitude on behalf of everyone that you guys are putting your lives out there for humankind. And I think you chose a great profession. So congratulations.
I think that too. Thank you very much.
Good luck and stay safe. And maybe after the coronavirus, we could do another segment that will be a completely different discussion.
Yeah,
so
sure.
Thank you again. Enjoy
thank
your
you very much.
evening, and I will be in touch. And thank you so much for watching Conversations with Jennylyn. When a conversation is all you need to be inspired and educated, as in this case. Thank you so much, Felix.